Hello and welcome to the CONECTboard video for January, giving you the update of the key messages from our board which was held at the latter half of last month. The board started this month with, as usual, with a patient story, and this month we had a presentation from matron Mandy Carney giving an update about a patient who had had an unfortunate fall in CDUP, which was being used as an escalation space in a particularly challenging time where bed capacity was under pressure. This patient had actually got out of bed for themselves, an elderly gentleman, and had unfortunately fallen. And we were very alert to the fact that we needed to make sure that we investigated why he'd fallen and to take action very quickly. Mandy talked through the process with Joe Howarth, our Associate Director of Patient Safety and Quality, and this was one of the first cases where we'd actually done a real-time root cause analysis, where actually that day we started the process of investigating why the patient had fallen, and also we were very quick to inform the patient's family about what had happened and made sure that they were up to date as the investigation proceeded, and made sure that they were informed of any actions that we'd taken to make sure that the incident wouldn't happen again to that patient or indeed any other patient. The board were very interested to hear about both the actions that we've taken to reduce the risks of fall when we have escalation spaces open, but also very keen to understand how the real-time root cause analysis and the new duty of candour that we'd shown towards the patient's relatives played out, and we're very supportive that this needs to be something we undertook on a regular basis where these sorts of incidents happened, to make sure that family, relatives and patients are kept informed at all times if anything does go wrong or there's an incident, and that also they're kept up to date with the learning and making sure that we take the steps necessary to prevent the event happening again. In my Chief Executive's report this month, I was able to update on the progress for a replacement for our HR Director. Mark Power is leaving us in the middle of February to go to the Oxford Radcliffe Hospital, and the search is well underway now for our new Director. Once again, this will be a joint appointment with Dorset County Hospital, and we're out to advert at the moment and interviewing on the 10th of March for the replacement, so we'll update further when we have some news on that front. In terms of other things we talked about in my report, I updated the board on some of the winter monies we've received from the Department of Health this year. We've received £726,000 to support improvements in our management of patients over the difficult winter months, and that money is already being deployed to support initiatives such as the new Frail Older Persons Assessment Unit, additional beds in nursing homes to support patient flow out of the hospital, and a number of other initiatives that will hopefully make sure that winter is as well managed as it can be. I also updated the board on progress around the stroke review across Somerset. Many of you will know that the Clinical Commissioning Group, or CCG, have been undertaking work to look at what the future provision of stroke services should be across the county. And there's been a recommendation previously studied by the CCG that all stroke services should be centralised in one location in Taunton. Currently, that's only a proposal that's being discussed by the CCG, and there's a lot of further work to do to establish the pros and cons of that option. And that process is still ongoing, and I was updating the board on that, and we will obviously update the staff across the hospital on a regular basis as we have further news on that. John Howes, our Medical Director, updated the board on our recent visit by the 7 Deanery. The Deanery are the body who oversee the training of our junior doctors and make sure that the quality of the experience they have as junior doctors, both in terms of their education, their training part of their role, and also their pastoral side, is looked after by all the various hospitals across the region who host junior doctors. We met with them recently, John and myself, with Paul Foster, our Director of Medical Education, and a number of the junior doctors themselves met with the Deanery on their visit here. Pleased to say that the overall feedback from the Deanery has been very positive, and indeed one of the really great things was that the junior doctors commented on how friendly and supportive Yeovil Hospital was to them when they were working here. There are also some areas where we know we need to make further improvements, and we've got a plan with John that John's leading with Tim Scull and Tim Porter to make sure that we can continue to improve the experience for our junior doctors and make sure that they deliver the best care that they can do whilst they're with us. Helen Ryan, our Director of Nursing, was able to update the board on a number of issues. First of all, progress around the work on safe staffing levels. Many of you will know that following the Francis report into Mid-Staffordshire last year, there were recommendations that staffing levels in every hospital should be looked at. There's new national guidance expected shortly on recommendations around safe staffing, and it's expected that that will recommend there should be 1 registered nurse to 8 patients on a general ward. Helen and her senior nursing team are just doing work at the moment to understand what the implications of that would be for us here at Yeovil, and she's also working very closely with Tim Newman, our Chief Finance Officer, to make sure any financial implications are understood in the budget planning for next year. Helen also gave an update to the board around changes that we've made to our patient experience team, and many of you will also have noticed the changes at the front of our main entrance, where we've actually brought the PALS team, the general office team and the main reception team out into the main entrance to be a much more proactive presence, meeting and greeting patients, visitors and relatives when they arrive. And the initial feedback from this has been really positive from those patient groups, people feeling that they're very much welcomed into the organisation, and any problems or issues they may have, whether that's on arrival or indeed when they're leaving, are able to be dealt with quickly, either by directing people into our PALS team or dealing with the situation there and then. So it's a really positive feedback to the board, and they were very supportive of that as a way forward. Finally, in the same vein around patient involvement, Helen's done a lot of work recently with the Patients Association, looking at how we engage and involve patients and their carers in developing services here in the hospital. And she's just initiating a new group which will be coordinated by the Patients Association to pull together interested patient groups from across the spectrum, older people, younger people, people with disabilities, people with particular needs, to make sure that our patient involvement within the hospital is as inclusive as it can be for everybody. And the board were very encouraged and supported this approach that Helen's leading going forward. Tim Newman, our Chief Finance and Commercial Officer, also updated the board on a number of developments in his area, and Tim has responsibility at director level for estates, commercial development, IT, so was able to update on a couple of capital development projects that have taken place over the past month or so. First of all, obviously Tim was able to update on the progress towards the refurbishment of Ward 6A, and many of you will know that the ward has reopened now following its refurb to make it a dementia-friendly ward, and it's been a really positive feedback from both staff and patients about the great experience they've seen on 6A since it's been refurbished. Tim also updated on the work that's been undertaken to create the Frail Older People's Assessment Service, or FOPAS, in the Queensway Day Hospital. And again, a really good example of how a new service has been delivered, led by Rani Sophia, one of our consultant care of the elderly physicians, to improve the way we care for older people in the hospital. And it's really great to see that Tim and his team are heavily involved making these important changes to our physical environment, which make a real difference to the care we provide to our patients. Similarly, Tim updated on the bid we've recently made to the Department of Health for additional funding for improvements in the maternity unit. And I'm pleased to say we've just been notified that we're going to receive another £200,000 of capital money to improve the environment on the labour ward, particularly making sure that we're catering for women who are giving birth and their families in the most comfortable surroundings. So it's really good that with those improvements that we've already started in the labour ward will continue with this additional funding that we've received. Overall, Tim was able to update the board on our financial position, which remains broadly positive for the rest of this financial year. We're projecting that we will be in line with our predictions in delivering a small surplus at the end of the year, but it's important to say that we have underperformed on our cost improvement programme this year, and we will have a significant challenge ahead of us into next year because of the non-delivery of a number of our CIP plans for this year. But overall, our position remains balanced, and in the current economic climate, it's a great testament to the hard work of people across the organisation that we've been able to we're projecting to come in on a balanced financial position at the end of March. Finally, Tim was able to get the support of the board to improve an upgrade to the MRI scanner in radiology, and this is a really important piece of work that we'll be undertaking over the coming months to make sure that the MRI scanner is as up to date as it can be, and supporting the important work of the radiology department and the rest of the hospital. Finally, we had an update at the board on the early results from the NHS staff survey, and many of you will have completed the staff survey here at Yeovil, where we surveyed the whole workforce within the hospital. We've only just recently had the early results, which are very high level, but overall there's a mixed bag. We had some areas where we performed very well, and indeed there were some really positive improvements on last year, but there were also some areas where we haven't delivered as well as we would have liked, and areas that we think staff are telling us perhaps things aren't as good as we would have liked them to be. So we as the board were very keen to understand more detail about where those areas were, and we're waiting now for the final results to come through, which have a lot more detail below them, so we'll actually be able to develop a clear action plan and make some concrete changes which will hopefully react to the feedback we've had from this staff survey and make sure that we continue to look at how we can improve the working lives of our staff here in the hospital. March the 3rd is NHS Change Day, and that is a day across the whole NHS where people are being encouraged to think about making a change in something they do in their day job, which will positively impact either in the way they work, improving the way they feel about their job, but more importantly, making a change that will make a real difference to patient care. And I know obviously everyone is very committed to making sure that they always do the best for our patients, but I will really encourage anybody in the organisation to have a think about a small thing that they might be able to do as part of NHS Change Day to make a difference to the way they deliver services here at Yeovil Hospital. There's a lot of information on the web about NHS Change Day. You can Google it and find it that way. And our comms team will be putting information on YCloud and communicating widely across the organisation about the movement that's happening both nationally and locally. But I'd really start encouraging you to think about now and about making a pledge of something you're going to do to help make NHS Change Day a success both here in Yeovil and across the wider NHS. Thanks very much.